Hello and welcome, everybody. Thank you for joining us today. I'm Kathy Rowe of New Jersey Advocates for Aging Well. And if you have heard anything from me over the last 15 months, it has probably mentioned a multi-sector plan for aging. That is something that we are really pursuing here in New Jersey with the Lifelong Strong campaign and the state exploring a multi-sector plan for aging. So we were thrilled when we saw Ocean County doing a county level one on their own. So today we're going to talk to Maria LaFace, who's the director of the Ocean County Office of Senior Services, and Kathleen Cullinan, the assistant professor from, I'm going to get this right, Rutgers Cooperative Extension of Ocean County. Did I get it all?
Yes.
Um, so we want to hear from you, like what you did, why you did it, and how a multi-sector plan is going to help not just Ocean County, but how it can serve as a model for New Jersey as we move forward as this for a state. Um, I'm going to turn it over to you to start, Kathleen. You just tell me when you want me to advance the slides.
Okay. Whenever you're ready, we can move ahead.
Did that move?
Yep.
All right.
Perfect. Thank you. Well, good afternoon, everyone. Thank you very much for joining Maria and I this afternoon. Thank you, Dr. Rowe, for the wonderful introductions. We're so pleased to be here and to share what they call our experience, strength, and hope with you for developing a multi-sector plan for aging, either at the county level or at the municipal level, and as Kathy had mentioned, hopefully at the state level soon to come. So just a little bit of a background on age-friendly Ocean County. This was a close partnership between Rutgers Cooperative Extension and Ocean County and the Ocean County Office of Senior Services. The Ocean County Office of Senior Services was funded through the New Jersey Department of Health and Human Services, Division of Aging Services, in the first round of age-friendly grants soon after I began my position as a community educator in Ocean County. And Ocean County was also in the process of meeting its age-friendly requirements for renewed designation as an age-friendly Ocean County through ARP, which is an affiliate of the World Health Organization. Which we can talk a little bit about later. So basically, the goals of Age-Friendly Ocean County for both the grant as well as ARP's redesignation were very similar. So it was very ideal in terms of timing for executing this project. We had to have a cross-sector community advisory committee, which was already in place thanks to Maria LaFace, already running the Ocean County Office of Senior Services, Senior Advisory County Council. Community assessments needed to be conducted, some of which were already taking place within Ocean County. We needed to launch a countywide communications campaign, which we have and will continue to do so. And then develop a multi-sector plan for aging based on secondary data review as well as data collected through this grant opportunity. And then, of course, disseminate these findings. And this is one example of how we're disseminating our findings of our experiences with age-friendly Ocean County in developing the MPA, as well as meeting the age-friendly requirements via ARP. And next slide. Right. So Ocean County was one of the 5 designated age-friendly counties in New Jersey. And New Jersey as a whole is the 7th state to join the ARP network of age-friendly states and communities. I believe just this week, Maryland joined as well. So we're one of 15 states or territories, including the U.S. Virgin Islands, who are part of the national network. And in 2023, our office, our 5-member board of commissioners made the commitment and made the resolution for Ocean County to become the 3rd New Jersey county to join the ARP network through adoption of a resolution. And then within 3 years, Ocean County, because of the top-down multi-sector commitment, which we'll address in today's webinar, we were able to develop the first government approved county level MPA in the state of New Jersey. And this did officiate our designation through national ARP as well as an affiliate of the World Health Organization Global Network for Age-Friendly Cities and Communities. So it's really a global and local alignment for this project. And now I'll turn it back to Dr. Rao, who will launch our questions, I believe.
Yes. And everyone, we are recording this. We will give you the recording. But if I was going to ask them some questions, if you want to add your questions to the chat for now, I will address them. And then at the end, we're going to have time to take people off of mute. We have it in a meeting format, not webinar, so you can really ask questions and we can have more of a discussion. But we'll probably cover several of your questions as we go through these. And Maria, I'm going to start with you. So, what was it that prompted you to do this, to do a multi-sector plan for aging at the county level? Why did you choose it, and why did you pick it over other things that you could have done with this grant or other opportunities? I mean, you were already working on an age-friendly county. What made you do this?
Well, first, let me thank you for having us and allowing us this opportunity to talk about it because I still, as I sit here today, cannot believe that we created the first multi-sector plan in New Jersey. So thank you for giving us the opportunity to share it. But basically, what started it's a little bit of a story. I started as director in 2018, and one of the things that I did when I first started, probably because of my background, is I started researching the population I was going to serve, the needs of that population, what funding, what were the roles of my department. And I quickly realized that Ocean County was the retirement hub of
Yeah.
New Jersey. I learned very quickly that I was to serve the fastest and largest population, fastest growing population. The demographic shift was in my face from the day I started. And so it just was, I think we did it out of necessity is basically
Okay.
what I'm saying. Post COVID, the needs skyrocketed. So you figure if I started in 2018, we started thinking about what are the needs. We did our first public hearing, and then, 2020 comes and COVID hits. But before
Hmm.
COVID hit, NJAAW, which is the Director Association of the state of all AAA directors in the state, we already sort of knew this. We knew that we had a wave coming. The demand was growing, the needs were growing, and the funding was sort of flat. So we were
Okay.
fortunate enough pre-COVID to meet with or to be asked to testify at the assembly committee they had at that time. They had a assembly committee on senior services, and it was great. We went there, we were the directors, we testified before the assembly committee on the needs of older adults. We expressed concerns over housing costs and all of those things that we saw. And
Okay.
then COVID hits.
Yeah.
And it just changed the landscape overnight. I mean, when COVID hit, the call volume in our office skyrocketed. I
Yeah.
can tell you, we immediately had to start a pilot project for vaccines for older adults because we quickly learned that when you're going to administer mass vaccines and appointments are only online, that
Right.
older adults were not able to do that. So I think we made over 10,000 appointments during COVID. And then what was really eye-opening was we realized that when the outbreak started in the nursing homes, we realized how critically important it was to keep people in their homes, and how important community-based services were. So that's after COVID. So then I hear this word age friendly, and I attend a workshop. And from there, we became members of the AARP, and I was appointed to the State Senior Advisory, Age Friendly Advisory Council. Learned a lot through that process. So I guess why did we do it and why now? It became really clear to me early on in my career in aging, that the demand was growing and outpacing the funding, and we had to figure out a way to meet the needs of this growing population with the resources that we had, and taking a bird's eye view at the system. Just it was the right time. It was the
Okay.
right time.
Great. And For a lot of plans, you can, or it comes from the top down, the state level down. But I know that for a multi-sector plan, whether in the county or state level, it really requires input from the community. So, Kathleen, what kind of outreach did you do to get that input? And how did you make sure that you had like a real representation? You had, representing the county's diversity, not just, the people like the squeaky wheels, not the people who like to
Mhm.
complain a lot. What was your outreach and your strategy for that?
Well, like I said, thank you, Maria. This was just such a perfect time for developing an MPA. Everything was already in place. Community needs assessments were already taking place. When I first came on board in August of 2024, there was a partnership for a healthier Ocean County steering committee that was formed by the Ocean County Health Department that was already a multi-sector coalition of public-private nonprofit partners, including caregivers, individuals with disabilities, as well as older adults. And so that was a perfect opportunity for both Rutgers Cooperative Extension of Ocean County, Family and Community Health Sciences Program, which I'm a part of, as well as Senior Services to get on board. And that actually culminated in their public health accreditation just this year as well in 2026. And this is the first time the Ocean County Health Department did receive this prestigious accreditation 1 year after the state health department. So the time was right. If you can pull up the slide, I can give some other examples of how we got involved. On that coalition, we had all of our county department heads. Ocean County is very unique. I've worked on two governor's wellness initiatives in the state of Rhode Island, and I kind of always use the analogy that Ocean County is like a little Rhode Island. It's very close-knit. Partners work very closely together. And it's not the same old people, but it is a very diverse representation from multi-sectors at the county level. And we're hoping to expand that now to the state departments and state partners as well as we implement the plan. So we were actually able to get the county health assessment that was being implemented by the Ocean County Health Department, tailored to our own needs to meet age-friendly designation, and it was approved by ARP. And so we assisted the health department with disseminating that both digitally and in paper through Maria's, the AAA Ocean County network of AAA providers, through Meals on Wheels, through congregate meals, through senior centers, home individuals at home as well. And so we were able to get that survey out in large print as well as digitally. We were also able to get the input of key stakeholders through that initiative, as well as focus groups. This was before we even conducted our own focus groups in collaboration with 35th Street, which is a marketing research firm based right in your home county of Mercer County, Dr. Rowe. And also, as Maria had mentioned, annually the AAA's Ocean County Senior Services conducts their public hearing as well as their annual needs assessment. So they have more than 2 years, they have decades of data showing the needs of Ocean County, older adults in Ocean County, caregivers, and older adults with disabilities. But we were able to get the most recent data through the most recent data sources that were available to us. We also relied on your beautiful survey, Kathy, that came out in August of 2024. And that was right when the RFP through the New Jersey
Mhm.
Department of Human Services Division of Aging Services was released. So that was very timely. As you know, the blueprint came out in May of 2024. Your data, your statewide data report segmented by county came out in August of 2024, and this grant was due in September of 2024. So it just seemed like it was planned by the stars that these timelines aligned so well. And the Ocean County Health Department had already launched its community needs assessment. As part of our efforts, as I mentioned, we contracted with 35th Street, which gave us some very enlightening qualitative data to really
Mhm.
put the face on these numbers that we were looking at and garnering through online as well as paper sources. And I stress this because it's helpful for anyone working on an MPA at the municipal or the county level. We also relied on the community health needs assessments of our nonprofit
Okay.
hospitals serving Ocean County that are required to do a community health needs assessment every 3 years to maintain their nonprofit status. So we garnered that data and used that data as well to inform. So Maria had talked about her service on the development of the blueprint under the Murphy administration. A lot of that served as our framework for developing our own plan. We overlaid those findings with what we found at the county level, and we came up with what we think are very achievable goals and strategies and proposed partners for achieving those goals within the 3 years that we have received the extended designation via ARP.
Wow.
Can I
So,
just jump in there? Because one of the
Yeah.
two things that I found very helpful and unique, because it's something that we don't do at the county generally, were focus groups, small focus groups, and also town halls where we worked with our municipalities and had small town halls. And I think we gathered a lot of important information from those events as well.
Yeah.
So, Kathleen, I don't know
so
if you wanted to say more about that, but I was impressed with the conversations that occurred around
Right.
those tables.
And that's what I wanted to ask you next. Like, especially Maria, your staff is answering the phones. You know what the usual complaints are, right?
mm.
How was this different? So I forwarded to the qualitative data in your own words. How is this different than the usual, like what somebody might call about, logging complaints, logging those calls? This seems like it gave you data you didn't have before.
It absolutely gave us data that we didn't have before. And yes, I started this process, and I will be honest, and I think I've said it before, by saying, what are we doing here? We know the needs. We hear the needs every day. We have stakeholder meetings. We hold public hearings. So why are we going through this? We already know the needs. And I will tell you, and I think I said it at our launch, by the end of it, I really drank the Kool-Aid. I learned that, we do public hearings. Every county department who's receiving funding, we do public hearings, and people come out to public hearings. But and those are forums where they are supposed to share their concerns and gaps in services and things like that. But oftentimes, it's really just like you said, a complaint. These are the complaints or the failures of government and things like that. It does not necessarily lend itself to a dialogue. And I
Right.
think that is what was so critical about having a consulting firm doing it. One, they're experts in how to start those conversations, and to get people not just to say, I need transportation, but
Hmm.
to talk about how the lack of transportation impacted them that very day
Yeah.
or last week. And
Yeah.
so I started out thinking, I know it all. I don't need to do this. But if you want me to, I will. And then by the end of this process, I really learned the difference was, yes, people will come out to normal government surveys and public hearings and voice their gripes, but it doesn't necessarily give you the kind of interaction that I saw happening when I visited those focus groups. People really talking about not just the issue, but sharing real life experiences. And just some of the quotes on the screen are the ones that came out, and they shock you. People are planning their health care around their transportation as
Hmm.
opposed to the other way around. And so things like that wouldn't necessarily have come out in my public hearing. Now,
Yeah.
transportation, they would have said transportation's, not good in Ocean County, but the examples that they shared by discussing it with somebody outside of the normal process really made it the substance was incredible.
Okay.
um that was the one thing that I really felt like I thought we had it in the beginning. I thought we are age friendly in Ocean County. How dare everybody? we
Yeah.
we listen to these stories every day. But this process taught me a lot about going outside of what we normally do. And I will say that one other thing that I came out of those focus groups was the appreciation that the residents had, that we were all, ourselves, the consultants, everybody, putting so much time and effort into hearing from them and
Mm,
listening to them,
okay.
which is not necessarily something you get at a public hearing or through a survey.
Right. Right.
So, yeah, it was I thought a very meaningful process, but it really was critical to have people in the field who are experts at engaging folks like this.
Okay. So then let me ask you both, did you want me to move the screen forward, Kathleen, or take it down for now?
Yes, there's some additional quotes. These
Okay.
are just
Oh, yeah.
very sample.
And these are similar to the writing quotes that we got from the statewide survey too. And I think like, these aren't what gets logged as the normal complaints. It's really getting the context and the struggles that people have.
Yes. If I could just add one thing,
Yeah.
certainly when we started our journey, going through the data and collecting additional data, food insecurity was certainly an area and is an area of need in Ocean County. However, through the focus group findings, what emerged, which was very interesting, was an improved need for multi-sector collaboration at the
Mm,
local level because we're human beings, our social needs are complex, they get more complex as we get older, and so having all of these entities talking to each other at the table was very, very important, and we took that away, and we're going to be moving forward with the implementation with the partners that helped us develop this plan as well, both at the county and hopefully at the state level.
So let me ask you both, what do you think was the hardest part of doing this? Besides having a really tight deadline for the grant, what was the hardest?
I'll start. I can tell you that the hardest was really dedicating the time and commitment of resources to the project and continuing to meet the day-to-day needs of the residents who are calling.
Okay.
In government, we tend to be reactive. People are calling, they're homeless today, they need food today. So oftentimes you end up putting things on the back burner like the MPA. So the hardest part was really deciding how to allocate those resources so that we could take a step back, look at the bigger picture, engage in this process while simultaneously meeting the very critical needs of seniors on a day-to-day basis. Also, monitoring funding and policy challenges that may be coming down the pike that we had to advocate, educate our lawmakers on, either way. So there's a lot of work that goes into our day-to-day operations, and we have limited resources to get our reports in and, provide feedback on, and then to actually put the kind of time and effort into this was that for us was the hardest part. Now,
Yeah.
you mentioned deadline, right? And normally deadlines are a headache. They often, are like, rolling my eyes going, really, it's due. The deadline, I believe, and some may disagree with me, was critical in this process because it forced us to stay on track where
Mm,
normally my staff, myself, we're all inclined to deal with the suffering that is in front of us.
right.
And this made us address that, but also find the time and the resources to put towards this process. That's what was hard on our end. Kathleen, I don't know from your perspective, because you approach it from a different perspective, what was hardest for you?
Well, I think the deadline, as you alluded to, Maria, really was a blessing and a curse. It really forced us to really fast track this very quickly. And even the state's deadline for their meeting their grant requirements were reduced, I believe, from 18 to 15 months. And so everything, it was MPA planning on steroids, basically. And so that was a challenge, but it also made us get it done. I mean, we
Mm,
launched the plan on June 23rd. The grant ended June 30th, and we were approved at the national level on just July 2nd. So, and it was very fast track, but it was really rewarding as well. I just wanted to add, as Maria also mentioned this as well, this was during a time where we had administration changes from the federal down to the local level.
Yeah.
The same set of commissioners that approved this resolution in 2023 had already moved on, and we had new commissioners. Luckily, we had ground-swelling support thanks to Maria's leadership and the Office of Senior Services, so it wasn't a big sell at the local level, but I feel like we have to, now we have a new governor, now we have a new president. How do we get, how do we
Yeah.
continue this message of the importance of having a multi-sector plan for aging? And if it wasn't for, your leadership as well, Dr. Rao, and every one who's represented on here in terms of policies for multi-sector planning for aging in the state of New Jersey, I don't think, it would have gone so well. I think it would
Yeah.
have been a much heavier lift. Even though it was a heavy lift, it could have been heavier.
Yeah.
So we are thankful for all of the leadership of all of the statewide advocates for aging, for being here, for helping us, for guiding us. So much has happened in Bergen County, in Leonia, and other places around the state, and under your leadership as well. So we're grateful for that support. So the timing was great for our work, but it wasn't so great in
Yeah.
terms of the turnover of policymakers from the federal down to the local
Yeah.
level.
But
Yeah, I
every
guess I put that part out of my mind because I remember when it was all happening going, I've got to start meetings all over
yeah.
again.
But it
So
raises a really, really good point about sustainability. And that's what, so many efforts we struggle with when, the grant ends, how do you keep it sustainable with this turnover in leadership? But it sounds like
Yeah.
when you get the momentum going, it does have a life on its own and it's going to survive and last whoever the leadership, director, governor, county chair, whatever. It needs to be sustainable and it needs to be incorporated into just the way we do things, right? So, and that leads me to my next question, which is one of the benefits of MPAs. And I think it sounds like you guys did a lot of this, but when we talk about multi-sector plans, we talk about breaking down the silos. So it's not
Mhm.
the same old, same old. And how much of that did you see during this process? Did you find like entities that now are your partners, they never worked together before? Tell us about the silos and are they still standing or did they come down?
Do you want to
well, I
start,
can tell you a
Maria?
little bit. You know what I found the entire process involved collaborating and breaking down silos. I mean, that's exactly what it is. It literally is breaking down, calling my department heads from every county department, finding from them where their service, whether it was planning or roads or parks, where they interacted with older
Hmm.
adults. Older adults cross over every department. And so we've worked together, many of the departments, but we're now working with non-traditional departments that
Yeah.
we've always partnered with veterans, but we didn't always necessarily partner with Cultural and Heritage Commission. And
Okay.
now all of a sudden we have a whole bunch of events that we're working with the Cultural and Heritage Commission about the 250th anniversary that seniors can go to for free. And we
Hmm.
have Ocean Ride who's going to transport them. So
Yeah.
the process naturally, because it forced you to talk to partners and people that you wouldn't normally do
Right.
in your day-to-day work, everything from county commissioners, county departments, the State
Hmm.
Division of Aging Services, our relationship is growing stronger there. County, my advisory council, they have stepped out and have really taken on so much work enthusiastically, and they're helping to break down silos because I will tell you, some of those people on my advisory council are board chairs of one of 93 adult communities.
Yeah,
Talk about
yeah.
breaking down silos. So,
Wow.
for-profits, nonprofits, we had an agency that stepped up at the end of the launch to hand me their business card to talk about how do we improve transportation for seniors in Ocean County, an agency I had never worked with before, and we are now looking at ways to do that. I then was able to call the director of Ocean Ride and say, hey, I've got a transportation. So it was a natural, it naturally broke down. In order to
Hmm.
accomplish a multi-plan on aging, a multi-sector plan on aging, you've got to, that's what it is. It's breaking those
Okay.
silos. And so I really was impressed. We now have new things going on with the library. We just had our senior art show in partnership with the Ocean County College. And so some partnerships are ones we had that we've strengthened, and
Hmm.
others are partnerships we probably would never have really had. And so I thought it really helped us break down silos and build new
Great.
partnerships. And so, Colleen, I'll leave it there, Kathleen, because I'm sure just the work we did with Rutgers Cooperative Extension it's going to continue long after building this MPA. Um, so I found it to be extraordinary when it comes to breaking down silos and opening up the lines of communication. Anything, Kathleen?
That's right. We're married now, Maria.
I know, and we
Because you're
birthed
not going
and
anywhere.
we birthed a plan. Who knew?
That's right. So I guess the only thing that I have to add that emerged, and if you think about Ocean County geographically, we're on the coast, we have the pinelands, so we're very mixed geographically, and many of our older adults are very medically complex.
Okay.
Individuals that are vent dependent, oxygen dependent. So just within these 48 months, and I moved down here and to live in the oldest municipality in the state of New Jersey, Manchester or Whiting, with those largest number of retirement communities, 20 of the 93 retirement communities. So I got to get an on the ground view as to what was happening. So during the 48 months in my position, we've seen the Lacey Fire, which is the largest fire in the history of New Jersey. That also resulted in power outages, a lot of older adults running to the ER for electricity to keep their oxygen and their vents going. We had some of the worst snowstorm this past winter where people were literally plowed into their homes, and each of the 93 communities that Maria has mentioned is independently owned and operated. So there is a need to coordinate more about what is going on in these communities, and I live in one. And also flooding. So we have to also take into account the floods, which New Jersey is vulnerable to floods, but also
Hmm.
we're a coastal community. So we have to worry about inland flooding and coastal flooding. So that has driven us to work more closely with our first responders. And that means EMS, that means the sheriff's office, that means the police. So we do have the Ocean County Office of Emergency Management. That's a key partner in the plan development, but we want to work more closely with them, just like transportation, because the
Hmm.
most vulnerable of the vulnerable are those that are medically complex, that
Yeah.
are on oxygen or vent dependent, and other types of electric electricity driven medical devices. And so we saw that we don't want to have any more deaths.
Right.
And we've reached out. Now we have what's really interesting is now we have a partner. Ocean County has a partnership with the New Jersey Department of Environmental Protection. They've invited us, age-friendly Ocean County, to present on extreme heat in older
Hmm.
adults on August 12th. We're reaching out to New Jersey Department of Health to make sure that we're working more with all of the diverse populations. We are largely a white a non-Hispanic population, but we also do have pockets of underserved populations that are scared in this time and era to come
Hmm.
forth. And so we want to find ways to reach out. So we're working with the Office of Minority Health on getting some advice on how we can reach these vulnerable. So within the vulnerable, there's so many layers of vulnerability is what I'm
Hmm.
trying to get across. And so first responders is definitely a new multi-sector collaboration that I think we're going to be focusing more on in Ocean County, hopefully with the support of the multi-sector collaboration of state agencies.
Wow.
And under the Murphy administration, there was a 26 state agency council that was formed to coordinate emergency response at the local level across the state of New Jersey.
Okay.
So once again, the time is right for us to work together. And we are warming at New Jersey, not to go off on climate change, of course, but we're warming at a faster rate in New Jersey than any other,
Yeah.
than the nation.
Yeah.
And these storms, like we just had, Maria talked about the art fair, which is wonderful. We also just had our first Senior Day fair at the county fair this summer, and within 24 hours, we've invited our older adults to come out to Senior Day for free. But could they breathe? They were sandwiched between the wildfire smoke of West Virginia, the wildfire smoke of Canada. We had torrential rains all within a 24-hour period, and then we had to shut down the fair. So we have to take into consideration, the sectors beyond what we would normally even consider.
Right. Right.
So,
Two things I do want, Kathleen, two things that did come out of this that wouldn't normally have, or at least the one, Grunin Foundation, and the philanthropy and what they're working with us on this new text app. Maybe you want to speak a little bit about that, because this would never have come to fruition if it wasn't for all of the connections that we made during this MPA.
yes, thank you, Maria. So we're so grateful. We had reached out to the Grunin Foundation initially to start a grandparents raising grandchildren, because Maria touched on COVID. After COVID, we saw a huge rise, and during COVID, a huge rise in opioid use, not only within Ocean County, but statewide and nationally. And so there was a big need. We saw a lot of more grandparents raising grandchildren or relatives raising children. Unfortunately, it didn't take the traction that it took in Cape May County, the oldest county in New Jersey, but they had also been building relationships for more than 2 decades. So what the Grunin Foundation, they gave us seed money to launch that program. When a year in, they saw, it wasn't taking root, and they did allow us to pivot and use that seed funding to pilot a text line, which is developed by Bridge Social, a firm in collaboration with our colleagues at Rutgers Hub for Aging Collaboration under the leadership of Dr. Emily Greenfield, who's the founder and the director of Rutgers Hubs. And so there is so much potential for this particular text line. It's not meant to take over anybody's job, but it is for information, referrals, and resources for, we found, yes, the most common way for older adults to communicate with each other is by word of mouth, and that's been shown by 15 years of research. But older adults are texting, and
Yeah.
they will text the text line. And so we are piloting that right now, hoping for a full launch of that at our September 11th meeting. Hope everyone can come join us again at the Ocean County Library. And this is an AI-driven text line, but it's closed. So it's not pulling random information from the internet like ChatGPT. The error is minimized because it is a closed system, and it's
Right.
monitored on the back end through Rutgers School of Social Work and the Hub for Aging Collaboration. So we're just thrilled. We're launching that. We're launching other initiatives through the Rural Health Transformation Grant through New Jersey Department of Health. But this text line, I see it, once we get as many older adults, caregivers, and adults with individuals enrolled in this text line, this can also serve as an added enhancement to getting out emergency alerts. That's
Yeah.
my dream, that
Yeah.
this will be. It's not replacing anyone doing INA, information and referrals. It's actually hopefully going to free up time so that Maria's team, Maria's staff, her AAA network providers across the county can spend more time on these older adults that have
Yeah.
more needs than the average
Yeah.
older
Yeah.
adult. So,
Yeah. I remember seeing at your launch when I think Dr. Greenfield told people to bring it up, and the people in the audience could used it and found their own services on that already. So it was already set up and pre-programmed for what can serve Ocean County residents.
Yeah,
That was a
so I think everything is leading us to break down those silos if there's one
okay.
thing that's coming out of it, because these are things I know wouldn't have happened had we not gone through this process.
So now this is probably the hardest question. I'm going to put it to Kathleen first.
Good.
Do you know, do you expect if all of this is going to cost the county money or save the county money? And then Maria, how you just mentioned how it will like free up your staff. What will it do for staff time? 'Cause-
Right, Kathleen, you're first.
Okay, I'll make it brief since I get so passionate about this area. But in the end, I think it's actually going to save, if it hasn't already saved the county
Okay.
money, because we're using resources more efficiently. We
Okay.
have stories that we don't have time to tell you. We're happy to have sidebars or what have you. About the inefficient use of first responders, EMS, police, fire. At one particular home right here in Manchester, in one day, the poor woman just needed a help out of her chair and was stuck in her chair. And then the fire alarms went off, and it was just, it must have cost probably, it was a $20,000 day because those services weren't coordinated. And she, if somebody had just knocked on her door, she could have gotten out of her chair. It wouldn't have involved the police, the fire department,
Hmm.
EMS, and I think it's definitely going to save money in the long run. Our services are going to be more coordinated. Time is going to be freed up for addressing more needs that require more resources and more time. And I'll turn it over to Maria.
Yeah, just in that vein, well, one of the things we're always looking at is the reduced costs of emergency. Look, if we can surround more people with services,
Hmm.
and we do it efficiently and collaboratively, we're going to have less people falling, less emergency room visits, less hospitalization rates. It reduces the cost of the, costly institutional care. Um, Retention of residents staying in New Jersey, which is key right
Hmm.
now because a lot of our older adults are really considering ways to leave the state because of, they can't afford it. And it's a more efficient use of our resources. It avoids duplication. So now we can do in-house referrals. You call me and you need to access I don't know, a home repair. We can
Hmm.
make that connection for you very quickly rather than giving you a phone number, having you call them, leave a message for them, hope you're eligible. So just the better coordination between the departments, the streamlining of referrals between agencies, and lack of duplication. That
Yeah.
alone is going to save the county dollars. But then I always look to if the more people we keep out of nursing homes and
Hmm.
in the communities, it's always a heck of a lot cheaper, Kathy and
Hmm.
Kathleen, to provide a medical alert button, a transportation to a doctor's appointment, a little bit of
Hmm.
social rec and Meals on Wheels than it is to have that person in a
Right.
nursing home. And so
Right.
in the long run, I believe the savings will be significant. Not only that, it will be just a better system overall. I believe the quality of the services
Yeah.
will be better.
Right.
So that's how I see it.
Right. I mean, I had drafted a couple more questions, but I think we've covered it all. I want to open it up to other people's questions. But I just want to say first, everything you're saying, that is what we're calling for with the Lifelong Strong campaign. I'm going to put the website here in the chat. And Kathleen, if you would put the Ocean County website in the chat so people can see it. And one of the important things is that we would we need to track that data, right? That's something that we have to, in the long run, prove what we're doing, have a data dashboard, track the progress against the goals. And there's no other way to do it without the multi-sector approach, because otherwise we're still operating in silos. One hand doesn't know what the other one's doing, and we're not delivering either the best services or creating the best experiences and quality of life for residents. So we're going to be watching very closely. My last comment is I think it is great that you are doing this at the county level because of the way New Jersey is structured and the AAAs, there's one in every county. But I also want to emphasize this doesn't replace the need for a statewide MPA. This doesn't mean that every county should do it their own way, which is kind of the New Jersey way of doing it. If other counties do it, that is great. And we also need this at the state level. So with that, I want to open it up to other questions. Julius, I saw your question in there. I think I just asked it, but if there's anything else you want to ask, if people want to take themselves off of mute, or raise your hand, we'd love to hear from you. Um, I'm not expecting answers to every single question, Marie and Kathleen, because we know this is still relatively new. But please, anybody that has a question, just take yourself off and go ahead and ask.
Hi, Julia. I see
Hi, nice to see both of you. Thank you so much.
you.
Yeah, my question was just about how you would be comparing future data to the data you collected to do the assessments, and if you set yourselves some goals, or are there priority categories where you want to see movement?
Kathleen, I'm going to let you speak to that since you wrote it, so it's probably in that mind of yours.
My numbers. So yes, so the data that we have will serve as a baseline. Even though our grant funding at the state has ended, ARP does require us to evaluate progress throughout. They actually have a 5 years cycle. Our plan is 3 years. So we'll be collecting data throughout the 3 years, both quantitative and qualitative. And we will be flushing out action plans for each of the priority areas. Certainly, transportation has focused surfaced to the top, so that's going to be one of our areas. Information and referrals, that will be the work group supporting the text line. And also, social connection has surfaced as one of the priority areas. And so we're utilizing some funding that has come through the New Jersey Department of Health through the Rural Transformation Program for getting seniors enrolled into Vivo, which is an exercise program that can be done at a senior center or home-based. This is a statewide opportunity through the federal allocations to all health departments nationally. So yes, we will be setting, those smart objectives, specific, measurable, achievable, realistic, time-related objectives for each of those priority areas. Can we address all six? No. So we're focusing initially on the text line. Initially, the commissioners have already stepped up and put money aside for doing a countywide assessment of transportation routes and timetables, and also for social connection. This is a very evidence-based program, and we're going to be using both not only physical fitness measures, but also social connection measures and mental health, etc. So that's a great question. Evaluation is everything, and we have to show that what we're doing is making an impact throughout the
And
grant
I will
cycle.
tell you, Julia, it does help to have academia on your side helping you.
Mm-hmm.
Because while you're doing the work and living it here, they are gathering the data and making sure that we are meeting those milestones. And so, if there's a school or a college in your area, you might want to look to connect with them. I think it's a meaningful process for the school, and it is very, very helpful. Because it would have been overwhelming if I had to also
Yes.
internally capture it all, draft it all, and then track it all. So if I could recommend to anybody, if there is a school or something that can work with you or a research firm, it does help because we still gotta do the work.
Mhm.
Right. Yeah, everybody has a job to do.
Yep,
Thank
yep.
you. Thank you. And congratulations for, all the work and for attracting the attention of other important entities that can support you. That's really great. So kudos to
Thank
both
you.
of you.
We're very fortunate in Ocean. I will say this, and I say it all the time. I've been the director of the Office of Senior Services now for about 10 years. And I have gone to my commissioners probably yearly to express concern over shortages of funding and to educate them on the needs of older adults. And I have never been turned away. Um,
Mhm.
that is not always the case. I hear from
Right.
colleagues around the state. And so getting buy-in, and that's what made my job easier. Once I sold it to them and I got buy-in from them, everything else moved. Departments started opening their door. It all started to move. But I'm fortunate in that sense. I think though, if they take the time to listen to what we're saying, they're going to understand in the end it makes the county better, which makes them look better.
Yeah.
Well, that's
Good.
great. Sometimes a county commissioner will say yes, but it's about putting the money where the commitment
Exactly,
is.
exactly. And I
Yeah.
will say, the county, when we initially started this, we didn't always contribute to a position at Rutgers Cooperative Extension to
Hmm.
assist with this. And the county did dedicate
Yeah.
dollars for that position. And that
Awesome.
was a key win for me when I was able to, educate them on that and how it would help.
Interesting.
Yeah.
So
So
yeah, put your
important.
money where your mouth is what I
Right.
always say.
I
Good.
also have
Great.
to add that Maria is a lawyer, so she can part the Red Seas.
Some days, not in my house with my 20-year-old daughter, but in other places I
Yeah.
can part seas.
Emily, I see your hands up. You want to take yourself off mute?
Yes. Hi, everyone. Maria and Kathleen, thank you so much for this. And Kathy for facilitating as always. You know, I'm a huge fan of your work and have my eyes closely on all things Ocean County with the creating the best possible future for all of us aging in New Jersey. This question is a little bit for Maria, I think. It's so interesting for me to hear kind of your perspective as the director of a county office on aging and kind of this duality of your role, and like appreciating this opportunity to do what you know is important, but also having to manage your jurisdictionally defined traditional role as a AAA director. And I wanted to ask you to, like, what has been your impression of kind of interest in this work among your AAA colleagues in other parts of the state, and also kind of the role of the AAA network in New Jersey in supporting an MPA at the state level in terms of like getting behind the advocacy for that, or really kind of helping to co-own the importance of that for our state, or not, hasn't really happened yet, like just kind of those relationships.
I can tell you that in my other hat, I am the president of NJAAW, which is the Directors Association for the AAAs in New Jersey, and we are all committed to this process. And last year at our annual summit, we had AARP come down to talk to all of the directors about their process, and we all, like I said, that we were the first group just because of what we do to realize, oh my goodness, we are not going to be able to meet this need. We are going to be run over like by a train if we
Hmm.
don't stop and start preparing. And so all of the directors are on board, and all of them are committed to working with the state to get a state MPA in place.
That is
It'll
great to
it'll
hear.
serve as the broad guidelines for all of us, and that always helps. We'll take it at the local level and tweak whatever those priorities are to meet the local needs. But when the state sets broad priorities for all of us, it strengthens the arguments down here that I've got to make to my local governors, but my local legislators. But it just really will help us all be moving in the same direction in our
Mhm.
own individual ways, because if you know a county, you know one county, right?
Yeah.
But we'll all be moving in the same direction. And so I am confident that my colleagues support it, and you're going to be seeing more of it.
Janet, you have your hand up?
I do. Hi.
Janet, you're my inspiration.
Well, it's good to see all of you and congratulations. I am really, really impressed. I've been a thorn in the side of Bergen County trying to get them their own age-friendly task force going. And I know they have one going now, but it's taken forever. The Division of Senior Services has been a champion of this since day one, as you know, I'm sure, Maria. But it's just has taken a long time. So it's very inspiring that you actually have things going, and it looks like you're on a really good track. So congratulations.
Thank you. Thank you. But it was one of the meetings that you were at early on, that really got me interested in looking into age friendly and all of this. So thank you.
Great. Thank you.
I see Kathleen Casper. I see you're off mute. Do you want to have a question?
No, I don't. Thank you.
Okay. Anybody else? We are coming up on an hour. I will send everybody the recording, and the people who registered and were not able to attend will send the recording in the chat. We have both the Lifelong Strong website and the Age Friendly Ocean County website. And I think we will all plan on being in close touch over the next few months. Um, If you are not already receiving the Lifelong Strong newsletter, which goes out, it's a little irregularly, but we are sending out a new one in a couple of weeks with updates on our progress and also examples and stories from other states. If you would like to be added to that newsletter, you can either email me or you can go onto the Lifelong Strong site and sign up for it there. And we really hope you join us. We're very proud and happy that there has been a bill introduced into the state assembly. And when they reconvene, we will be monitoring that and sharing information with you. So we think we're taking the steps, we're going in the right direction. And I hope that the state is right behind Ocean County on signing off on this. So thank you everybody for joining us. Maria and Kathleen, I
Thank
know you have
you.
absolutely no free time because now you're doing all the work in the plan. I appreciate you taking the time out of your day. And honestly, just best of luck. It's so impressive on what you have done in such a short time.
Well, thank you. We
So
Thank you
certainly
so
couldn't do it
much.
without the support of everybody on this call and beyond, because it's going to take all of us
all right.
to prepare our state for what we're going to see. So thank you. Thank you for listening.
Okay, thanks.
Thank
And
you.
I'll see you all again soon.
Thanks, everyone.
Thank
Bye.
you.
Bye-bye.